Thank you, Dr. Manjusha, for so beautifully presenting to us how candidates are selected for a transplant. We now move on to our next speaker. We have with us Dr. Jitu Korean, who's going to be discussing with us the initial testing process for different types of transplants.
Thank you, Marianne, for the introduction. And let me thank the Kidney Warriors Foundation for calling me for this wonderful conference to give a small talk on initial testing in renal transplants. So let's get going. So this will be the flow of my presentation. I'll just introduce the topic to you. And then how do you work up a donor for the kidney transplant? How do you work up a recipient? And what are the special situations we need to take care of? So this is how the scene sets in. We have a donor who is willing to part with one of his kidney to the recipient, who is the chronic kidney disease patient who's either on dialysis or is waiting to get started on dialysis. So from here on, the person who's donating the kidney is called the donor, and the patient who receives the kidney is called the recipient. And this recipient has to continue taking medicines all throughout his life to live as close to normal a life. So when I go through this presentation, the procedure seems to be a little complicated. And the first question you'll ask is, why do we really need to go for a renal transplant? And here comes the answer. That's because it's the best form of renal replacement therapy. That means for a patient who's on dialysis because his kidneys have failed, the renal transplant tends to be the best form of therapy. Why? That's because the quality of life on transplant is far superior to a life on dialysis when the person has to come twice a week, thrice a week to the dialysis center and go back home, not able to do his work properly. So the quality of life on transplant is better. And when we look at the duration of time for the patient survives, or how long does a patient on dialysis survive as compared to a patient on transplant, and they see that the transplanted patient lives longer as compared to the dialysis patient. And if you look at the cost effectiveness, definitely the cost of renal transplant and its medications are far less than when you compare it to lifelong hemodialysis. So we are convinced that definitely renal transplant is a superior therapy as compared to dialysis. So how do we go about it? So we need to work up the donor for kidney donation. The fact is that we need to work up the person so that we need to see that the kidney is fit enough to be donated. Second is that the donor is actually parting with one of his kidney. And we need to make sure that the donor doesn't have any problem post-donation, and he continues to a life as normal as it was when he had both the kidneys. So that is the aim of work of the donor for the kidney. The first and the most important thing is the blood grouping. And here we do the blood grouping of the donor and see that whether it matches with that of the recipient. We have come so far that we actually can do transplant across blood groups, but then with the special therapy and its extra cost. Then once the blood groups are done, we go through the medical evaluation, which actually involves a systematic history, examination of the patient, and laboratory evaluation, which involves imaging and scans to give us a final interpretation of how good the organ is for the recipient. And it's just not medical evaluation. We need to look at the psychosocial aspect also. And last but not the least, the kidney which is taken from the donor, when it's put on the recipient tends to reject the kidney. And we need to see that what are the chances that this kidney will get rejected out of the recipient, and what is that we can do to reduce it to the best possible way. This is something which is commonly asked by the patient and their relatives. Can I donate? My blood group is O positive. It is negative. Can I donate across blood group, etc., etc. When it comes to renal donation, the blood group works exactly like the way how it works for our blood donation. That means to say that the O blood group here can donate, or a person who's got an O blood group can donate his kidney to any of the blood group, making it a universal donor. As well as a patient who has AB blood group can receive blood or kidney from any of the blood group, making an AB blood group universal recipient. So just to reiterate again, a donor with O blood group can donate his kidney to any of the blood group, and a recipient or a patient who's AB blood group can receive his blood, kidney or blood from any of the blood groups. And does the positive and negative matter? No. As far as kidney transplant is concerned, the positive and negative really doesn't matter. Now, once we have done a blood group, we go to the next step of medical evaluation. Here it involves systematic history and physical examination, laboratory evaluation, and next, we need to see what's the functional status of the kidney. So what is the degree to which the kidneys are functioning? How much does each kidney function? How much does each kidney contribute towards the total functioning of kidneys of the donor? And then we go to the next step of doing a CT angiography or to imaging or to find out what is the structure of each kidneys, how many blood vessels go to each kidney, what is the structure of the tube which comes out of the kidney, so that this all sort of helps us when we are actually doing the transplant surgery. In the history, we need to look at the history of any medical illness, because here we are looking at a donor who's apparently healthy. We need to take a detailed history of his medical illness, about does he have diabetes, does he have hypertension, has he undergone any surgery? If it's a female, what is the obstetric history, etc. Does he have history of passing blood in the urine? Does he have history of protein leak in the urine? But because this all might actually point towards a renal problem. Then, apart from the medical things, we need to look at what is the Thank you, Marianne, for that introduction. And I thank Kidney Warriors Foundation for giving me an opportunity to speak on this topic on their national conference. And I'll be speaking in the next 15 minutes about testing in renal transplant patients, the donor as well as the recipient. The flow of my presentation will be an introduction, the workup for the donor of the kidney, how do you work up the recipient of the kidney, and what are the special situations. So this is how the scene is. We have a donor and who's ready to part with one of his kidney and is ready to give it to his recipient, who is a patient who's on dialysis or who's going to get started on dialysis. And the recipient has to take lifelong medications to live as close to a life as normal. So at the end of this presentation, the procedure might look a little tedious. And then the question will arise, why do we really need to do the transplant? The answer to this is that it is the best form of renal replacement therapy. That means for a patient who is on dialysis, transplant seems to be the best possible therapy. Why? Because the quality of life on transplant is far better as compared to dialysis, when the patient has to come to the dialysis center 2 times a week, 3 times a week, etc., not able to carry on his daily activities, etc. The transplanted patient tends to live longer as compared to dialysis patients. And if you look at the cost effectiveness of this program, the renal transplant and its medications are less costly as compared to lifelong hemodialysis. So next, we go to see how do you work up the donor of the kidney. The first and the foremost investigations we do is the blood grouping of the donor. This is to match the recipient's blood group. So science is so much advanced that we can actually do transplant across blood group, but doing the blood group of the donor and the recipient is important because additional therapies are required when we do transplant across blood groups. Once we do the blood group, we need to do a medical evaluation, which consists of a systematic history examination of the patient, laboratory evaluation, and imaging and functional status of the kidney evaluation. Then after the medical evaluation, we also look at the psychosocial evaluation, and we look at the psychosocial factors involved in the renal transplant program. Last but not the least, we actually need to work up for the immunological evaluation, which is actually looking at the chances of the recipient rejecting the donor's kidney and what is that best can be done prior to the transplant to reduce the chances of the same. So this is something which is commonly asked by everyone, that can I donate my blood group is this? The answer to this is that the rule which governs the kidney donation is very much same as that of the blood donation. A person who has O blood group can actually donate his kidney to any of the blood groups. So O blood group can donate to O can donate to A, O can donate to B, and O can donate to AB also. And a patient who's on dialysis and has got AB blood group can actually receive kidney from any of the blood groups. So that makes it a universal recipient. So once more, the O blood group is the universal donor. That person with O blood group can donate his kidney to any of the blood groups, and a patient who has got AB blood group can actually receive kidney from any of the blood group, making it a universal recipient blood group. Does the positive and negative matter? No. As far as kidney is concerned, the positive and negatives of the blood group really doesn't matter. After doing the blood group, we do a history and physical examination, the laboratory evaluation, as I said, and also the functional status of the kidney, because we need to take this kidney and put it in the recipient. How good is the functioning of the kidney, and how are the structures in the kidney? How many blood vessels go to the kidney? How many ureters or the tubes which come out of the kidney are how? Is it single or is it double? All this sort of tells us the function and the structure of the kidney we are going to harvest, and that will help us to decide which kidney to take, and it also helps the surgeon while he is operating in the operating room. As far as the history and physical examination is concerned, we are actually looking at a relatively healthy person who's ready to part with one of his kidneys. But that doesn't tell that he's free of all medical illnesses. We actually might have to take history and evaluate to find out whether he has got some kind of illness which is actually hiding behind. So we need to take a history of diabetes, hypertension, coronary artery disease, heart attacks, strokes, etc., etc. If it's a female, we need to actually look at what is the obstetric history like. It's also important to look at the social history, the employment history, because the patient is going to get admitted in the hospital. Post-surgery, he might have to take rest for some time. So what is that is going to fetch him his daily living post-surgery? What is the social support he has? So all this history needs to be added while you're evaluating the donor. And last but not the least, vitals examination and physical examination is very important. What are the laboratory tests we need to do? We do a simple basic blood counts. We need to see whether the bleeding parameters are normal, because we're doing a surgery, major surgery, and his blood should clot when it's required to. And we need to do the viral markers like HIV, HBsAg, HCV, CMV, etc. We try to do the liver function test and the renal function test to see how the liver is functioning, how good his kidneys are functioning. We also try to see is there any blood in the urine? Is there any protein in the urine? This might actually be telling that he might be having some kind of a very silent kidney problem, which if missed might actually result in kidney problems once he donates the kidney. He might not be a diabetic at the outset, but we need to actually look at whether does he have a chance of developing diabetes? Does he have a hidden diabetes? If he has got some relatives who has got diabetes, we actually are supposed to check something called an oral glucose challenge test, in which we actually give them a particular amount of sugar and see what is the level of glucose in the bloods, and that sort of tells you that he has the chance of developing diabetes in future. We also do the ECG, echocardiography, and also we do something called a cancer screening for the donor, which is age appropriate. So at a particular age, what all are the things which we need to do as a part of a screening program to find out a hidden cancer also is done as a part of the donor evaluation. This is what I was telling. Look at the functional status of the kidney. Here we actually inject a dye, a nuclear dye. It sort of goes to the kidney and tells us how much is the right kidney is functioning, how much is the left kidney functioning. So here we looking at it, we actually can see the right kidney is functioning with a GFR or a filtration rate of 55, and the left kidney is functioning with a GFR of 60. And it actually tells you the percentage of functioning of each kidney. And we tend to take the weaker kidney out and put it to the recipient and keep the better kidney to the donor himself. We also do something called a CT angiography, which is actually a structural imaging, which tells you what is the size of the kidney, what is the number of blood vessels which goes to the kidney, what is the ureter, how many ureters are going to each kidney and to the bladder. And this sort of tells us the anatomy, which helps us with respect to decision of the kidney harvesting on table. After all this basic evaluation, we go to the multiple departments like cardiology, pulmonology, that is the doctors who deal with the lung diseases. We actually get evaluated with doctors who deal with the liver and intestinal problems. And at the end of it, we go to the anesthesia doctor who are actually giving us anesthesia during the surgery. And last but not the least, the urology team who actually will be doing the surgery. So next is an important component which actually might be forgotten in many a times is a psychosocial evaluation. Because this is a donor who is actually healthy, but we need to look at the psychosocial aspect and the mental aspect of the patient. We need to see whether the donor himself understands the risk involved in donation and post-donation. We need to determine if the decision of donation is actually out of free will or it's coercive. And also we need to see what is the occupation of the donor, what is his employment status, and what is social support system that he's got. And next is the immunological evaluation. As I said, this sort of tells you how much is the chance of the rejection from the recipient of the donor kidney. So here we have two things called the HLA typing and the cross-matching. HLA is basically the genetic makeup of the donor. We try to see how much is there a match between the genetic makeup of the donor and the recipient. Of late, we have got very good drugs which sort of gets away with this HLA typing. But certain kind of scenarios, we need to do the HLA typing and to see does the recipient has gotten certain proteins against the genetic material of the donor, which tells you that we need to give additional therapy. Cross-matching is another test which actually looks at the protein particles which the recipient has against the donor body. And we try to see if it's there, we need to give more therapy to reduce this particular protein. So these are expensive tests which are sort of done towards the end of the workup, after you do the basic workup, so that if these are all the basic workup is done, then they go to HLA typing and cross-matching, which are relatively expensive labs. Now, after finishing the donor evaluation, we go to the recipient. Recipient is a person who is actually having kidney disease. So here we need to look at the kidney disease per se, because knowing the kidney disease will tell us what are the chances of this disease coming in the new kidney. If he has already undergone a kidney biopsy, we need to see the biopsy to see what is the disease. What are the chances of this disease recurring in the new kidney? Does he have a family history of renal disease? Because these are certain diseases which can actually recur again in the new kidney. Another important point we need to ask is that, does the recipient has history of blood transfusion, multiple pregnancy, previous transplant, etc.? This is because once the patient has these risk factors, they already have certain antibodies or proteins which can actually act against the donor kidney and cause the graft loss. History of immunizations are important because we need to immunize the recipient for certain infections like chickenpox, pneumonia, etc., etc. We need to see there is any bladder problem or not. If there's any problem in the urinary bladder, does he have history of stone disease, history of surgery, etc. As we work up the donor, we need to do our basic blood counts, the bleeding parameters to tell us how fast the blood will clot, the viral markers like hepatitis B, hepatitis C, HIV, cytomegalovirus, we do a liver function test, we do a renal function test. We are actually supposed to do a recipient age-adjusted cancer screening, which is like an age-adjusted screening for cancer, because we're going to give medicines which actually can predispose them to worsening of the cancer if he has already got one. We do a chest X-ray, we do an ECG echo, and in certain group of people, if there are risk factors, we actually go about doing a coronary angiography, which tells us the status of the blood vessels to the heart. We also try to do a Doppler of the legs, veins of the legs, as well as the pelvis, because these are the vessels to which we are actually going to connect or suture the kidney to. And last, there are certain special situations. As I said, we do an ABO compatible transplant, which is the transplant within the same blood group. But science has advanced, we have come a long way, and we try to do transplant across the blood group. And in certain such situations, we need to see what are the antibodies against the particular blood group in the recipient. And based on that, we need to give special therapy. As I said, the transplant recipients could be sensitized, like in the case of a pregnant, multiple time pregnant female who's going for transplant, or a patient who's already undergone transplant, who has received multiple blood transfusions. These are all people who have got antibodies against the donor kidney. And hence, we need to determine the level of antibody, and we need to give special therapies. So as I described, these are the minor steps we need to be stressing when we are evaluating the donor, the recipient, and certain special situations. And I would like to conclude the talk with that saying that you have not lived today until you have done something for someone who can never repay you. Thank you once again for your patient listening, and I'll be happy to take any questions. I thank once again the Kidney Warriors Foundation for giving me an opportunity to present this before you. Thank you so much.